Thank you very much for joining us once again for one of our webinars. It is a pleasure to be able to host you online as CIO East Africa. As mentioned, the previous webinars are to make sure we connect to technology solutions in the market, create a platform where you can engage freely as technology decision makers in your organizations and exchange ideas and best practices. So today we have a session on leveraging big data in the age of COVID-19. In the last 2 years, if any of you have been attending the CIO East Africa summits, we've been talking about data a lot. And because we do know that data is a big deal forward, no business decisions can be made without data. We collect a lot of data in our organizations on a day-to-day basis. And the question is, what do you do that is intelligent with that data to improve your performance and to be able to serve the business from a technology perspective? And you create an environment where the people who need the data use it as self-service and are able to interpret it for their own needs in the different departments. So today we do have 2 speakers. As usual, our webinar will run for 1 hour. We do have 2 speakers. We do have Ben Mann, who's the COO at IBM Kenya. Ben is a friend of CIO East Africa and is presenting at our summits, and we're very excited to have him online at our webinar today. He's a guy who has a lot of fun with technology and makes it look like you're watching Cartoon Network. So let's see what he's going to do with data today. And then we have Peter Akech. Peter is the founder of Mensa Analytics, and the interesting thing that Peter is going to do today, he's going to actually do scenarios that he has been able to create with data that he has collected that is live. And I think that's very exciting for our attendees today. So without much further ado, just one little thing on housekeeping. As usual, post your questions in the Q&A. We'll have the 2 presenters go first, and then they will take your questions after that. Over to you, Ben.
Thank you very much, Laura, and it's a real pleasure to be here again with you. I hope that wherever you are, you and your loved ones are safe. I know we're living in difficult times. It's great to be part of this event, albeit virtually. And I hope that my internet signal and my power, my electricity, survives the meeting. I think you can see some flickering from the lights here, but anyway. So it's great to talk about this very important subject. How can we use data of all kinds to help us confront the challenges that we're facing as individuals, as organizations, as citizens in this age of COVID-19. And I want to tackle it from, I guess, more of a technical angle. And I'm excited to see what Peter will be sharing with us shortly. So going into it, first of all, you know, when you think about the business or organizational challenges that we're being faced with, I kind of put them into 4 different areas. There are obviously threats to people, threats to our IT systems, and particularly the security of the data that we have today. I want to talk about how we can protect our people, our systems, and in particular the data that we have, so that that data can still be usable, even in the situation where we're working as we are remotely. Secondly, there's a big gap, whether we're talking about in a commercial context with customers or governments engaging with citizens. The traditional way that we interact with one another is gone. And so there's this disconnect, this gap. So how can we digitally engage, but also understand our clients better to drive a new business? What many organizations are seeing are shocks in demand. Some things, maybe the demand is dropping. Other areas, there are huge spikes, and clients need us to be able to respond. So let's look at that part. And then not so much focusing on data, but I'll touch on these because they support the idea of using big data. Of course, a lot of organizations are freezing their capital expenditure. They're freezing their business operations. They're introducing austerity measures. How can we make sure that we stabilize the business through the continuity and be able to pivot to OPEX, to different forms of investment rather than capital? And then underpinning all of this, we think of our own organization, but of course, we're part of an ecosystem, part of a supply chain. Much of those supply chains are now disrupted. So how can we then use, again, big data and technology to strengthen our ecosystems? Those are the 4 areas I want to just briefly touch upon. So looking at the first one here, the threats to people, processes, and IT. Again, one of the first things we can look at is how do we support the health of the humans, the employees, the citizens that we have? How can we make sure that they can quickly get advice on what's happening with COVID-19? How can we ensure that decision makers, maybe the folks running the business, looking at business continuity, policymakers, have data that they can use to make decisions? And can we look also at how we can use data to further flatten the curve by monitoring individuals, communities, and assessing risks? The second area, of course, is empowering remote workers. So many organizations right now, I'll take the banking sector as an example, are following the advice which says no more than 50% of the staff should enter the office. Ideally, no one should go into any offices. Ideally, everyone should be able to be productive working remotely. But even if you have half of your organization going into an office, how can you make sure that the other half is being productive, that you're getting a return on the investment, that those workers are able to be productive as well? How do we leverage analytics for that? And then, of course, cybersecurity. How do we introduce cybersecurity that is very smart, that's able to use data to look at patterns of behavior so that we can enable people to work more effectively from home? So just touching on those areas, how can we address it? Well, one of the ways that we're seeing a lot of interest from organizations, a lot of work that's going on, is using what we in the past referred to as chatbots. The technology has advanced a lot. Many now talk about AI assistants to differentiate them from simple chatbots that can do very simple dialogues to much more sophisticated tools that are able to access bodies of information, know context, are able to hand off to human beings. So one thing that a lot of clients are rolling out are chatbots specifically around COVID-19 to give citizens, to give employees advice, things like how do I get supplies, to do some kind of initial diagnosis to see if I have symptoms, where can I go for help, and so forth. And you can see an example here of a virtual assistant called Rona. You can go to rona.co.ke. This was developed by a startup company in Kenya, and they're using these kinds of tools to offer these services to citizens. So it's a very good way of getting that information out there, providing a very interactive experience to give health advice. So let's look at a second way that we could use analytics, and that's by building dashboards of data from different data sources. Again, these are our friends at Rona. They've used a variety of different tools and techniques to pull in data from different data sources and do analytics, overlaying the analytics with geospatial data. So this is actually views of different counties. And you can see over time, the data that's available from health organizations is being integrated and displayed so that decision makers can look at patterns and they can make assessments. So there's a lot of interest now in pulling this data together, maybe comparing it with weather data, location data, and so on, to get a better understanding of where the hotspots are. As you look at more sophisticated forms of analytics, this is a project that we're having conversations with locally. We have this running in Latin America, in Brazil. This is where we're looking at spatial analytics and contact analytics. So by a collaboration between government and telcos, we can begin to collect information about location of citizens. We can mask that information so that no one organization knows exactly who the individual is. But across the various organizations, we can begin to identify individuals that might be at risk. We can identify where they've been traveling, where they say they've been traveling, who's been in contact with them, and then filter that information through to the relevant authorities that are then able to follow up either with an individual risk assessment for a person or some sort of action. Now, obviously, solutions like this raise privacy concerns. As I mentioned, there's, I want to use a big word, obfuscation, and that's where you can basically hide the individual identifying information, the phone number, the name, and so forth, and only provide that information to organizations that have a need or a right to know. So there are techniques that can be used, but obviously this requires a lot of information, a lot of collaboration between the medical authorities and the telcos as well. But that's something that that some countries are beginning to do, and as I said, conversations that we're having here in East Africa. Now thinking about empowering remote workers. It's very frustrating when I hear many organizations where their staff are not able to be productive working from home. Currently, 99% of our staff are working remotely and staying productive. And that's good, not just for the economy, not just good for the organization, but it's also good for our mental health, quite frankly. Otherwise, we'd be sitting at home worrying about the future of our own careers. But what's needed is smart management of the devices. So the situation we have here is that we might be using devices provided by an organization or even our own devices, our own laptops, our own phones, and what have you. How can an organization roll out effective management and security of those devices without ever touching them? And that's what unified endpoint management is all about. This is a very important tool. I think a lot of organizations should look at it right now because it enables employees to keep working safely. It separates the corporate data or the business data from the personal data. So a device that might be owned by me, it might be used by my family, children, and so on. That those applications, that data is separated from the corporate data, which is very sensitive. I can't even cut and paste something from my work email into a non-work application. This is a kind of tool that uses AI to help me implement policies that might say, okay, if a device hasn't got the latest update, some patch, it can't connect to my network until it has been patched, or I force it to be so. So again, this is a key tool for organizations right now, not so much analyzing customer data, but analyzing traffic, network traffic and application data so that my staff can remain as productive as possible. Let's look at another area. This is within the network. So a lot of organizations right now are very concerned that opportunists will use the fact that these networks can't be accessed locally by staff, and they're launching more and more cybersecurity attacks. Now, where does big data come in? Well, there are cybersecurity approaches that rely on usernames, on passwords, on firewalls. Think of these as being like a door or a gate or a bar, trying to prevent access for somebody attacking and getting into your network. What is needed, though, is a much more sophisticated data-driven approach to cybersecurity, in addition to the usual barriers that we put in front of our data. What you're able to do here is actually look at network traffic and user behavior and look for abnormal patterns using AI. So, for example, the CFO of an organization might be logging in at 3 a.m. and creating new accounts and depositing money in them. They have access. Their passwords are acceptable. They have the authority. They can connect in through their VPN. So in traditional terms, there's no cybersecurity issue. But that pattern is abnormal. And it's the sort of pattern that a policy would pick up and say, this looks very strange. Maybe the CFO isn't really doing this. Maybe they're being forced to do it, or their device has been stolen, or maybe this is a rogue internal attack that I need to guard against. So again, looking at big data, but using it to address the cybersecurity risks that we face today. Just briefly covered how we can deal with threats to people, our IT systems and our data. Let's talk a little bit now about how we can re-engage with our customers using data. And we'll touch on a few ways that we can do that. One is to engage our customers digitally, and the other is to use big data analytics to really understand what's happening with our customers. Where are the demands? Where are the patterns and trends so that we can drive new business? Now, obviously, when it comes to engaging digitally, there's almost no substitute for using a virtual agent, effectively a chatbot. These chatbots can be developed very quickly now, even by people with minimal technical skills, and they can be integrated with customer service platforms, contact center, telecommunications platforms. And these virtual agents now know how to hand off to human beings. They also know when to search data sources like manuals and databases to answer more complex queries. Then, of course, when it comes to looking at client insights, I've seen a huge spike in interest in organizations trying to understand their customers and their citizens better. So I think this situation is really pushing a lot of organizations to realize that they're not in touch with their clients. That when they have to engage digitally without speaking face to face, there's actually a big gap in what they know about their customers. This is when we want to take unstructured data and structured data, combine it, and use natural language processing so that we can actually turn this information into a structured data source that we can then analyze and draw insights from. And in particular, we're looking for predictors. We're looking for patterns that predict behavior. So we can build machines that effectively can help us to improve our operations in business today. So those are kind of the key areas of using data, both in terms of cybersecurity, enabling our employees to stay productive, bridging the gap by engaging with our clients through digital assistants, and then tapping into unstructured and structured data so we can really understand what is the user, what is the customer behavior, what is the citizens' requirements, so that we can then meet them in this new digital age. I'll just touch very briefly on other things that are important. As I said, we have often frozen business operations, austerity measures. That's where we need to pivot towards the cloud, hybrid cloud, connecting our on-premise IT to off-premise cloud environments, and in fact, making our on-premise more like a cloud. Running stacks like OpenShift so that we can make it easier to manage that environment. Then the last area is supply chains. So how can we again use data here? Well, here are a few examples. We can look at our supply network. We can start to share information using a digital distributed ledger technology so that we can better understand who are our suppliers. We can onboard suppliers quicker. We can make sure that the supply chain works more effectively. A second area is around food and medicine. This is about using similar technology, distributed ledgers or blockchains, to bring together the producers, the manufacturers, the retailers, so that we can track that medicine, that food from end to end. Now, why is that important? It's important because it can enable us to export more products and meet the growing requirements of other countries in terms of the products that they import. And of course, when it comes to consumption, then we can also ensure that what we're consuming, what we're sharing is fit and beneficial. And when we think of trade, international trade between ports, that's where TradeLens comes in, again, using distributed ledger technology to facilitate faster movement of goods so we can import faster and we can export faster as well. In terms of how we can get going, as I mentioned, a lot of organizations have austerity measures. We're offering a lot of free access to technology. Here are some examples. Please reach out to me, contact me to get any of these offers, and there are more also available. I want to highlight a few of those. Free 90-day access to creating a chatbot that is already trained to answer COVID-19 questions. So within a matter of days, you can implement this chatbot for a few months and use it to help your staff, your employees, your citizens get the advice that they need. Second one, I talked about endpoint management. Again, we're offering that free for 90 days. So you can immediately get your staff using their devices securely connected, making sure that those devices meet corporate standards and avoiding the danger of data passing between personal apps and corporate applications. You can read some of the other ones that are listed here. Data discovery, again, free. Cloud capacity, free. And a lot of companies right now are concerned that their employees are not as busy as they could be. This is a great time for them to build digital skills. Again, we're offering free skills at our Digital Nation Africa. So go to digitalnationafrica.com and you can learn soft skills like effective remote working and tech skills, cybersecurity, AI, and so on. Obviously, there's lots that we need to do to address COVID-19. Here is just a few of the things that we're doing, particularly around leveraging big data. So we're making high-performance computing available. We're looking at sequencing the genomes behind COVID-19, helping data scientists explore the drugs and use data to understand which medicine can be most effective, and also providing deep data search to scientists, doctors, and any organization that's trying to decode the COVID data, the research papers, the databases that carry all the medical information. I just want to open up an invitation to join me and the team May the 5th and the 6th. We're running a digital conference, the first of its kind, and we'll be focusing on how you can emerge as a stronger organization using data, and so that we can all strengthen our systems and use data effectively so that we can overcome the challenges that we currently face. So again, I hope you're all safe and well, and I hope that's given you a few ideas about how we can use data in this age of COVID-19. Back to you, Laura.
Thank you much, Ben. That was great insights on data, big data in this age. And I also like the fact that you also gave us, like scenarios of how we can use the data and how it applies, especially in the COVID-19 situation. I loved the threats, just to do a recap of some of the things we talked about on the threats. I love the way it's personalized. We're not only talking about businesses, we're talking about people, and people are always behind the business. Looking at even situations around how we can flatten the curve and make sure that we are all healthy and safe enough to be able to continue working in an environment that is stress-free and where we're not too worried about catching COVID-19. The security bit is actually very exciting for me because I've been seeing a lot of these quizzes online, and people are using them to keep themselves very busy, like on social media and that. And we don't know who is pushing out these quizzes. Is our data being collected? What is it being done with? Are we exposing ourselves from a security perspective? So those are some of the things that we need to think about. Some of the questions they ask.
Yeah, so we'll just invite Peter Ketch.
Thank you for the introduction. Yeah, my name is Peter. Kindly allow me to have my video off because of a bit of a network issue where I am. Yeah, I'm from Mensa Analytics. I do electronics design, embedded microsystems development, and basically how to transfer data from the source point to an online platform so that we can allow people like Ben to be able to now analyze this information. So if you look at the cases of COVID-19 in Africa, you can find that as of today, we have 16,115 confirmed cases out of a population of 1.3 billion in Africa. And when you look at this number, the percentage is very low. And it could be that it's low because of genuine low numbers, or it could be low because of fewer tests. And that has been a big challenge in Kenya and across Africa as a whole. So if you look at this graphic, it shows that the confirmed cases are less than 0.01% of the number of people who have COVID. And the biggest problem is how sure are we that the numbers are this low, or is it that we are not testing enough? So that's the kind of question we ask even when it comes to Kenya. You find like, again, the same problem prevails. The number of tests that we've conducted so far is about 15,000. We have 303 confirmed cases. And again, when you look at the percentages as presented, they're again very low. And this raises a challenge because if, for example, we have 303 confirmed cases, in Kenya we have 518 ICU beds. And as of end of March, 87% of those beds were occupied. So the key question is, how sure are we that whatever we are doing is enough to be able to confirm the number of cases we have, and how are we working towards addressing that? And as Ben has shown, a lot of this depends on the amount of data and how we analyze that data. So the question is, again, repeated there. If the few cases are genuine, then how do we prevent them from increasing? And this is a question not just for Kenya, but across Africa and across the world. And if the cases are due to inadequate testing, then how again do we optimize the testing such that the few kits that we have, we are able to optimize their allocation and be able to ensure that we are testing enough and we are capturing the cases early enough. So these are the questions that we ask ourselves as we are working towards fighting COVID-19. So one of the big data problems that we have right now is that the data that is being collected from those non-contact thermometers, let's say at entry points, at quarantine centers and all that, the information is being logged on paper records. It's actually being put on booklets, and there is no form of analysis that can be done on such information because, again, it's not in a digital format. And to be able to employ the tools we have with big data, then we need it to be in a digital format. So one of the things that we've thought about is how do we test for fever and flag cases of fever so that we can prioritize those people who have signs of fever become the first test points for COVID-19, because as everyone knows that fever is the first sign of COVID-19. And if we can be able to flag such cases, then it will help us in terms of knowing then amongst these people how many have COVID and how many do not have. Because once that, and that's actually the reason why you see there are so many places where people are being tested, their temperatures are being taken, and the information doesn't, in as much as it's not getting logged somewhere, that information is critical in that let's assume that someone is entering a commercial building and your fever, you test for a fever. Right now, there is no mechanism of that information being captured in such a way that it can be relayed automatically to a government agency or public health offices and be used in terms of prioritizing now you for a test. You are maybe turned away, that you are not allowed to enter here, and that becomes a problem because there is no follow-up information on that. So one of the things that we've worked on is how do we capture the fever data and transmit it? Because the information that right now is available is we collect the fever data, and because the devices that are in the field were never designed for field use, they were designed for individual home use, then that information is logged internally or not logged in some cases and cannot be transmitted. There are no data transmission capabilities in those devices. So this is the problem that we are trying to address. Yeah. So we have a video. I'm not sure if it's playing. We had a video of the prototype to just be able to check. It shows how we are testing for COVID-19 and being able to measure the temperatures of individuals when they are in public places or in various different locations, so that once that information is captured, then we transmit it to a centralized server database, and it enables now analytics to be applied on that kind of information. And with that, then we are able now to be able to prioritize in terms of which cases need to now go for COVID-19 tests. Maybe we'll share the video later with the participants. Yeah. Now, one of the advantage of the device that we've developed is that it has the same exact operation as the existing non-contact thermometers. So there is basically zero learning curve on the device. Then one of the things we do is also capture a unique identifier for a person who's being tested for fever. And this unique identifier can be a phone number, or it can be an ID number. And that information is logged. With the logging of that information, then we are able to now apply analytic methods on that kind of information, and thus be able to now narrow down on the cases that are available and figure out, does this person require now further care? For example, if the fever they have and we take them for a COVID-19 test, then we find that it turns positive, then it means that at least we've captured a population that would have been a risk at a later stage. We've captured them early. The thing is that the advantage of capturing these cases early is that we prevent the spread unknowingly, because there are certain cases where people are not sure whether they have a normal fever or a COVID-19 related kind of fever. And when we capture these people early enough, then it enables us to now be able to narrow down the cases and be able to prioritize in terms of test kits. Because as you know, like right now, Kenya is testing actually less than 1,000 people per day, and we have a population of around 53 million. So if that process continues, then how many days or months will it take to actually be able to test everyone and be able to analyze the information that has been captured in terms of now prioritization for COVID-19? And again, the bigger problem is that the number of ICU beds that we have here is 518. And this situation is actually replicated across Africa, because you find like most countries do not have enough resources to actually be able to hospitalize all those cases. So there's been a big push in terms of development of ventilators. But as everyone knows, is by the time that you get to a point where you need a ventilator, then it means that the case is already too late. So if we are able to narrow down the number of people who may reach that full-blown case, then it will be advantageous to us. So some of the benefits that we have on the systems we've been working on is enabling the collection of COVID-19 indicator data digitally. We are measuring temperatures digitally at the moment across Kenya and across Africa, but we are not presenting that data to platforms, for example, like IBM Watson, that can actually now be able to apply predictive analysis on that information and therefore be able to predict the spreads and highlight hotspot areas. And that's one of the critical aspects that we need to be able to take care of. Then application of analytics will actually lead to faster response and better management of the situation, because if we have less kits than we need, then the primary issue becomes how do we optimize distribution of these kits. For example, the government recently prioritized KPA for testing for COVID-19, but you end up finding like a place like, I don't know, it was Mandera or Moyale, one of them turned out to actually have a lot of people that needed to be quarantined because of the potential risk. And this was realized after kits have been taken to KPA. Therefore, how do you help the government in terms of figuring out which area should be priority based on the trends that you are noticing from the data that is being collected? So our primary aim is helping in terms of collection of data, and thus being able to now have a good enough sample of information collected so that we can be able to now apply predictive analysis to be able to now continue with tests and make the tests valid, or make the testing faster and optimized in terms of testing more cases that are likely to turn positive than testing randomly. So, for example, the device we have actually can do a single fever test in about 2 minutes. That is testing, taking 10 samples, averaging them, getting the maximum, and transmitting that information to a central server. So that takes about 2 minutes, and assuming we are testing for 12 hours in a day, of course, obeying the curfew hours, then we can do almost 10,800 people per month on one device. So if it's 1,000 devices, that means around 10.8 million people can be tested per month. And this will provide a big enough sample, because 10 million people out of 50, that's about a fifth of the population. It means it may take about 5 to 6 months to cover the entire population, basically using 1,000 devices. And these are the kind of benefits or cost-benefit analysis that we are doing and trying to figure out what's the best balance in terms of hardware cost, device cost, platform cost, and the benefits in terms of public usage, and helping and aiding in terms of testing now for COVID-19. So, and with this information, it can allow also accurate monitoring of fever trends in quarantine zones. For example, recently all of us have heard about the people who escaped from the quarantine center at KMTC. One of the challenges is that you may find that the person who escaped actually did not have any sign of COVID-19. They may have been an asymptomatic carrier of the COVID-19, meaning they have the virus, but it has not yet manifested, so no one knows. Or they may have been symptomatic, they have the virus and it has manifested, but they still escaped. Now, the biggest problem is because at the quarantine zones, again, the big problem is people are not being monitored on a daily basis. The cases of fever, we do not have trends. For example, what was your temperatures when you got in? 5 days down the line, what is the trend? What has been the trend throughout? And can we predict whether you are developing a fever or not, or the curve has remained flat? So these are the kinds of information that we are trying to figure out. How do we help in terms of getting that data and being able to analyze it? And in as long as that the information is offline, is in recorded books and government documents, it's not helping anyone. Yeah. So some of the comparisons of what we've come up with and what is currently being used is both use exactly the same medical sensor for measuring temperatures. So accuracy is assured. The devices that we have right now across Kenya and across Africa have onboard or minimal onboard memory, and the ones that have do recordings, as I said, they were not designed for field operations or monitoring temperatures of multiple people. So you'll find like they can record maybe 10 readings or 30 readings, but for one person, and there's no way of getting that data out of those devices onto a cloud platform. And these are the kinds of things that we are looking at and trying to figure out now, how do we enable that information to be fed directly to an online platform or to a server somewhere and allow now other people to be able to run analytics on this kind of information. We also integrated basically recharging. Again, look at it from a situation where you have a farmer market in a village somewhere, power may not be reliable, and you need to test people getting into the market so that you ensure that we do not mess their daily livelihood, because most of the people are rural and agrarian. They rely on farmer markets to sell and buy their produce and what they need. So how do you ensure minimal disruption of their daily lives, but also keeping them safe, in that you can flag out cases of fever and isolate them and test now those initial cases for COVID-19. So these are some of the things that we've looked at, and building a rechargeable system that can be charged either via normal power, USB, and solar, again, enables remote kind of operation of such a handheld device, and it enables us now to be able to reach far and wide. Because you find, like right now, most of the cases that are being reported are in town settings, but a big population is in the villages, in the remote areas. So how do we enable this kind of data to also be captured, and we bring it into an online platform to enable further analysis of that information? So some of the challenges that we are encountering, and that I know governments are also encountering, is in Kenya, as of statistics yesterday, the estimate is around 27% of people are asymptomatic locally. And with the link provided, there are other cases that have been monitored across the world. The percentages vary from 5 to around 80% of people being asymptomatic in certain areas. So you find like this becomes again another challenge, in that with such kind of devices that are monitoring fever, we can only be able to capture around 55% of the confirmed people who are symptomatic. But how again do we monitor the ones who are asymptomatic? And this is where now the use of AI and machine learning and platforms like IBM Watson come into play. Because now, based on the data they are being fed from the various government agencies, from the, for example, quarantine areas, from hardware devices like what we have, and from many other sources in terms of environmental situations. For example, right now it's a bit cold and rainy, so you will find cases of fever are high. So based on such kind of parameters, they can be able to look at all this data and predict, for example, like this is a hotspot, this area needs more monitoring, and this area might need more services in terms of now testing for COVID-19. And this will help in terms of prioritizing again, distribution of resources. And then the other challenge that even Ben talked about is data privacy and security of that data that is collected. Because for example, if our device requests for a unique identifier, of course, the person has to give consent. That information is useful in terms of contact tracing. For example, if you were in a mall and someone tested behind you and they tested for those signs and they are tested for COVID-19 and found to be positive, then you'd want to be notified of such a situation. So this will enable again data to be collected, and with that kind of information, then you'd want to be notified so that you do not risk your family or the people you're associating with, and you can be able to now go for testing. So consent and data privacy and data security, because a unique identifier, as we know, has been used in so many places. Phone numbers and ID numbers have been misused even in the local context, during political campaigns and things like that, people receiving unsolicited messages. So again, how do we guard against such kind of a situation? So one of the addresses that we've had in terms of that is instead of using a person's identity information or phone number, then people who are tested can be given a unique barcode number or an RFID number, and that is what is used in terms of tracing these kinds of situations or the locations where these people are tested, in order to narrow down now on the kind of cases that we have. So in summary, the increase in testing actually will help to reduce the cases of potential infection, because when you increase testing, you increase the number of data points that you have, the amount of data that you can analyze, and you can now be able to quickly act on places where that information is critical and needed. One example is like Germany has been able to fast track their containment of the virus despite a lot of deaths, simply because they ramped up their testing to about 350,000 people per week. And that has been able to help a lot. So in Kenya, if we can be able to ramp up our testing, we can be able to get there. But the problem is, again, the number of test kits are few. Therefore, how do we leverage on data that can be collected without using those test kits, so that now we advise in terms of optimizing of where those kits are taken. Then fever is basically, fever detector is one of the most important tools because it highlights the most visible sign of COVID-19. India has started reopening its markets and environment, but this testing has been made compulsory for all places. So you can see where that will continue becoming important. And as we've said, data is king. Data is everything. So when we use data to implement decisions and advice in terms of what needs to be done, then we can all win together. Thank you.
Thank you very much, Peter. I think that was a fantastic presentation. I mean, what I can say is that we are clearly seeing the power of technology, you know, and in this pandemic times, it is very interesting to see that the data has already been collected. There's some kind of analytics that has happened. And, you know, there's no other way to explain this except the power of technology. And that's why I keep saying those of us in the technology space are actually the leaders in the business. And we need to keep on leading by example and showing real life scenarios like what Peter has taken us through.